Hello everyone. Today I want to discuss with you a very interesting case which we have happened to discharge today. 59-year-old gentleman initially presented 6 months back with back pain, paraparesis, low hemoglobin and creatinine of 3. On evaluation, we did his bone marrow test which revealed that he's got a multiple myeloma ISS stage 3, which is a high-risk cytogenetics myeloma. He was started on myeloma weekly drugs, which is bortezomib, cyclophosphamide, dexamethasone, and it was decided to add immunotherapy with daratumumab because he had a very high-risk myeloma. 16 weeks onto therapy, he showed gradual recovery. Hemoglobin started to build up, paraparesis improving, creatinine coming down to normal, and on 16 weeks of therapy, his myeloma panel revealed complete remission in myeloma. This was the time we discussed with the family members that he is a perfect candidate for autologous stem cell transplant. Autologous stem cell transplant in multiple myeloma offers maximum progression-free survival. He was taken up in a transplant facility, which is a specialized transplant unit for this patient. He was admitted, Hickman's catheter was secured, apheresis was done, 300 ml of apheresis material was obtained and handed over to the transfusion medicine department. He was infused with high-dose melphalan chemotherapy to knock off his bone marrow, and 24 hours later his apheresis stem cell products were reinfused in his body. This is the time which is most challenging for the patients when their old bone marrow is knocked off, their WBC count is 0, and the new bone marrow, new stem cells take at least a week to mature granulocytes, and this is the time he started to develop fever, infection, gram-negative, CMV virus and a fungal. He was on all these drugs to tackle his antibiotics for his gram-negative infection. He was on posaconazole and acyclovir and then later to ganciclovir. A week he had a tough period, but day 10 his marrow started showing recovery. He started producing new blood cells. His neutrophil count increased gradually from 0 to 100 and then 200. It was stuck up in that range in spite of giving growth factors. So we decided to give him granulocyte infusion, that is giving a donor's WBC by apheresis to this patient. So after granulocyte infusion, the next day itself, his WBC started to grow tremendously. They were 1000 and then 2000, and this is what we call as engraftment, that is the new stem cells are working now, and he was on day 15 totally fine, comfortable, and today on day 16 we are discharging this gentleman. So my dear friends, multiple myeloma is a disease which can achieve maximum progression-free survival after autologous stem cell transplant. Stem cell transplant is not one-man jobs. It is not a job of one doctor. You need a team. You need a dedicated team where you have transfusion medicine facility, a good critical care intensivist facility. You need lab support, diagnostic support, radiological support, and you need, of course, a good transplant ICU nurse.